I'm Michael Castello. I'm a senior biomedical engineering student at WPI.
I'm Lasheen, and I'm a fourth-year biomedical engineering student at the University of Florida.
I'm Emily Sansoucy, and I'm a rising senior at Worcester Polytechnic Institute.
I'm Pooja, Thyvalappil, and I'm a sophomore at UMass Amherst studying biomedical engineering.
I'm Juliana, and I'm a recent biomedical engineering graduate from the New Jersey Institute of Technology.
To begin, here's our client/need statement. Developing countries surmount to 80% of severe fractures in the world. Due to the frequency of the injury and the lack of resources and equipment, fractures can be left untreated. In extreme cases, open reduction internal fixation surgery may be required. This procedure has been noted to cost upward of $3,000 in South Africa. Thus, there needs to be a non-operative, financially feasible device that can overcome these barriers and treat pediatric tibial and forearm fractures in sub-Saharan Africa.
In developing countries, severe fractures occur often amongst children. The frequency of injuries and limited resources and training lead to unavailability of the usual treatment for fractures, which is a locked intramedullary nailing procedure. Therefore, physicians must resort to other treatments, as shown in the pie chart, and locally made treatments for fractures, as shown in the pictures. While these treatments are viable, an affordable, adaptable option would benefit in the treatment of pediatric fractures. Low-level laser therapy uses near-infrared light to stimulate cellular metabolism. This type of phototherapy causes photon absorption to occur in the cell and leads to an increase in ATP production, causing pain relief and healing. The most commonly used wavelengths include 650 nanometers and 850 nanometers. Specifically, 850 nanometer wavelength has been shown to penetrate through skin, tissue, and into the bone, promoting bone repair and growth. LLLT is safer than direct infrared as it involves dealing with the tissue, and a broader range of wavelengths can be used as well.
Research was done to determine devices on the market today that use red or infrared light therapy to help inspire our design. Several unique devices were found, ranging from belts to pads to singular lights. Consistently, grid patterns were used for these designs, as well as a strap that can keep the device on the user or patient. Here are two design ideas developed during our brainstorming process. Both consist of a battery or solar-powered device that can heal either the tibia or bones of the forearm. The lights are to be arranged in a grid pattern for evenly distributed light, with the device is designed to house infrared wavelengths to penetrate skin down to the bone and improve healing quality.
Shown here is the final design of our wearable orthopedic infrared therapy device modeled in SolidWorks. The device's external surface is covered with a custom-printed waterproof polyurethane fabric. Patients can tailor their device's appearance by choosing from a selection of available African prints. 4 plastic strap buckles are attached to either side of the device, through which the provided polypropylene straps can be threaded through and fitted to the patient's forearm or leg. Also attached is a power pack 3D printed from ABS, a strong, durable plastic that can withstand heavy use and adverse environmental conditions. The switch connected to the power pack has an LED indicator that lights up when the device is on. The battery compartment of the power pack houses 2 pre-charged 9-volt lithium batteries that supplies power to the array of infrared LED lights patterned on the device's internal surface, and can be fully recharged in 2 hours using the provided USB cable. Fully charged, the device can provide 9 20-minute infrared light therapy sessions with a total battery life of 3 hours. Reversing the device, the internal surface is composed of a soft support polyurethane foam. Embedded in the foam is a 6x6 array of 850 nanometer infrared LED light strips. It is worthwhile to note that pores surrounding the infrared LED light strips are intended to further enhance the breathability of the device. Shown here is a breakdown of the components in our overall device. Most of our device's components can be bought in bulk. Here we have calculated the cost of each component for one device. Altogether, our device costs $36.40 to manufacture.
Presented here is our conceptual prototype constructed out of household materials. For this prototype, the West African Odingro symbols Aya and Dwenamin are incorporated into the design. Aya represents perseverance and defiance against difficulties, and Dwenamin represents strength in mind, body, and soul. These symbols and designs can be customized to suit specific regions and patient desires. This device is designed to wrap securely around the fracture site to provide the therapeutic red light treatment to the wounded area. Due to the adjustable design of the straps, this device is also suitable for tibial fractures. This device will be manufactured through an adapted model of secondary local manufacturing in which the necessary parts and equipment are imported into the country of need and manufactured by trained local personnel. This manufacturing model positively benefits the local economy while providing a personalized and high-quality device. Additionally, local manufacturers will be knowledgeable and able to perform device maintenance and repairs to improve the device's longevity. Further design considerations are required to ensure the success of this product. For instance, an easy-to-follow user guide would improve the patient experience, and medical personnel need proper training to understand the instances in which the implementation of this device would be beneficial. Finally, this preliminary design should be evaluated by local individuals, both experts and non-experts, to gain insight into how the design can be improved to better meet the clientele's needs.